Okay, hi, my name is Madison Salati, and the vulnerable population that I chose to do this presentation on is individuals with eating disorders. So, when talking about the description of the population, an eating disorder is an eating behavior that negatively affects your health. This can be seen as anorexia nervosa, bulimia nervosa, binge eating disorder, rumination disorder, avoidance/restrictive food intake disorder, and other unspecified eating disorders. So, the size of the population. I wasn't able to find every statistic that was called for, but felt good about these statistics that I was able to find. So, eating disorders are one of the deadliest mental illnesses and affect about 9% of the US population, or 28.8 million Americans worldwide. To break down that number a little bit further, about 1% of people suffer from anorexia nervosa, 2 to 3% have bulimia, 2 to 3% have binge eating disorder, and 4% have other specified eating disorders. And in a report published by the Utah Department of Health, it stated that in 2011 and 13, 4% of females and 1.4% of males in grades 9 through 12 had disordered eating behaviors. And these students also had high rates for depression, suicide attempts, bullying, and physical and sexual violence. So, the social determinants of health play a huge factor in those with an eating disorder. First, when talking about neighborhood and built environment, these individuals may not have access to a grocery store, which could cause them to become malnourished and lead to anorexia. Social and community context. So, how the media portrays that the ideal man/woman should look will play a huge part in the lives of those with eating disorders, and they may also not have positive relationships or interactions with friends and family members. Economic stability, they may not have the money to afford food, and education access and quality, they may not have the proper education about eating disorders. And they also may not have the proper education about how to properly nourish their body. And so they don't actually realize the harm they are doing to their body. And I don't have listed on here healthcare access and quality, but if they did have poor access to healthcare, there's a potential that their eating disorder wouldn't be diagnosed. And healthcare professionals can also lack resources, and diagnosing eating disorders can be hard. So, specific concerns. Psychological factors. Individuals may have a low self esteem. They may feel inadequate or feel that they have no control over their life. They might have depression, anxiety, or other mental health disorders. Interpersonal factors. They may have difficult personal relationships. They may be bullied due to their size and weight, and they may be experiencing physical and sexual abuse. Social factors. They may have cultural pressures about obtaining the perfect body. They may have a narrow definition of men/women and how their weight and shape should look. And they may be focusing on their physical appearance over their inner qualities and strengths. And biological factors, they may have some off balance biological chemicals in their brain. And genetics can also play a part because eating disorders can run in families. So, for adults experiencing an eating disorder, while genetics and psychological and emotional health may be the root cause of their eating disorder, it's likely that the fear of being judged is one of the root cause of their health disparities. So, the patient, if they choose to seek health care, they may withhold information due to fear that the doctor might shame or judge them. And in doing so, they're not sharing information with the doctor, and this makes it difficult for the eating disorder to get treated. So, next, moving on to Maslow's hierarchy of needs. I didn't feel that any needs of those with an eating disorder were being met based on Maslow's hierarchy of needs. For physiological, this is the foundation of Maslow's hierarchy of needs, and our bodies simply can't function or move up to the next tier if we are restricting food and water intake. Safety, there may be an issue with emotional safety. Love and belonging, this is a big stress area for those with eating disorders. Many times they will completely remove themselves from the lives of others because they're embarrassed or have a fear that family and friends are going to judge them. Self-esteem, many people with eating disorders don't have good self-esteem, and this could be the reason why they got the eating disorder in the first place. And self-actualization, Some individuals with eating disorders may feel that they don't have purpose or potential in this life, and when this happens, it can lead to suicide. So essentially, these individuals are not very functional, and some likely health outcomes that eating disorders can lead to are cardiovascular issues, gastrointestinal issues, neurological issues, endocrine issues, and many others. So, communicable diseases or infections, this population does not have an increased risk of communicable diseases or infections. For non-communicable diseases or infections, the first thing is poor physical fitness, and this is specifically seen with those with bulimia and binge eating disorder. This can lead to type 2 diabetes, obesity, and cardiovascular symptoms. And some things that can help prevent or manage these conditions is CBT, diet therapy, and physical activity. Next is that these individuals have an increased risk for mental health disorders such as anxiety, depression, OCD, and panic disorder. And 2/3 of people with an eating disorder actually suffer from anxiety at some point in their lives, and some have it before the onset of the eating disorder, and some have it after. Some things to help prevent or manage this is CBT and medications. So self-care slash self-harm, these individuals definitely have a self-care deficit. So without proper nutritional intake, you are not able to take care of yourself physically, mentally, and emotionally. Eating disorders can completely change your feelings, your mood, your behavior, and basically your everyday thoughts, and that turns into not being able to take care of yourself. They also have a risk for self-harm. They have a risk for self-harm behaviors such as cutting and suicide. 26% of people with eating disorders attempt suicide. They also have a high risk for hospitalization due to rapid weight loss, very low weight, cardiac irregularities, hypoglycemia, and electrolyte imbalances. And again, you're at risk for those harmful physical effects that can damage your cardiovascular system, digestion. It can affect your sleep and rest, your bones, your skin and hair, and your sex hormones. So what can be done to mitigate this harm is early intervention. If you know of someone that has an eating disorder, try to talk to them and help them on to a pathway of getting professional help. So risk for harm by or to others. So individuals with an eating disorder face the risk of being bullied by their peers, especially teenagers. And this can have lasting impacts on the individual's mental and physical health, which can lead to mental illnesses such as depression and anxiety. So what can be done to mitigate this harm is getting help. And if you are the person with an eating disorder that is being bullied, informing someone that that bullying is occurring, because by not telling anyone, the problem is just going to continue and possibly get worse. And these are the references that I used for my presentation, and that is it. Thank you.